If you are somebody who is on Medicare and lives in Los Angeles in 2025, and you like to keep your options open, at least as far as doctors go, hospitals, and provider networks, well, the Medicare Advantage plan, that is a PPO or a preferred provider organization, might be a good option for you. Furthermore, if you want the stability and the positive relationship that a large insurance carrier like UnitedHealthcare and AARP have, we have a perfect option for you, which is the AARP Medicare Advantage from UnitedHealthcare PPO plan available in Los Angeles. Hi, I'm Michael, and this is Michael's Medicare. Any of you or somebody you know has questions about their Medicare health plan options, either right now or really all year round, please feel free to reach out to us at the information down below. Either me or somebody from my team will be happy to assist them in person or over the phone at one of our many Southern California offices in English or Espanol. Also, don't forget to like and subscribe. So let's talk about PPO plans in general and then the UHC plan in specific, because the raison d'etre for PPOs are to provide a more expansive network of doctors to enrollees than is typically available in the more standard HMO-style Medicare health plans. These PPO plans do this by having two types of networks. They have in-networks providers and doctors and specialists who are directly contracted with the health plan and have set negotiated prices for all the procedures they could potentially do. Then the plan will also have access to out-of-network providers who are not contracted with the insurance carrier that enrollees can go to, but the insurance plan will help them pay for a much smaller portion of the cost that is unknown until the services are actually utilized. To help offset the potential risk of these unknown costs and unknown prices with unknown contracted doctors and unknown negotiated rates for services, most of those additional costs are passed on to the Medicare beneficiary when they do go to utilize those services out of network. So I think that is probably going to be the most succinct way to explain why they tend to be more expensive, that is PPOs, and just kind of perspective for us to look at as we move further into the plan. Furthermore, in the case of the AARP Medicare Advantage offered by UnitedHealthcare, it is a matchup of one of the most trusted senior groups, that's the AARP, and one of the most stable health insurance carriers in the country, UnitedHealthcare. And you know, it's PPO too, so it makes sense why it has all those things together. I think the easiest way to really get a feel for what are those cost differences though on a PPO between the in-network and out-of-network services, specifically on the AARP Medicare Advantage PPO plan, let's take a look at both the monthly premium and the maximum out-of-pocket cost for the year. The good news is that this plan doesn't actually have a premium, or I guess it does, but the premium is $0, so we want to be pedantic. Now, that doesn't necessarily mean that there is no cost monthly to maintain the plan. It just means that there are no additional payments required above and beyond the Medicare Part B costs that everyone has to maintain to keep the plan. That Medicare Part B coverage, just in case you were wondering, the cost for it is $185 a month to be paid in 2025, and that gets paid directly to Uncle Sam. So that still has to be paid even if somebody opts into the plan, and in fact must be maintained. So you have to keep it not only while you enroll, but you have to keep it the entire time be enrolled in that Medicare Part B, or the plan will cancel. Furthermore, when we take a look at the maximum out-of-pocket, or the MOOP, which is the most amount of money that an enrollee could pay in the year for their healthcare services, think of things like doctor's visits and specialists, hospital emergency, all those kinds of things, excluding prescription medications, but all the actual healthcare care, that maximum out-of-pocket, or MOOP, on this plan is at $6,700 a year, which frankly is a lot. It is on the very well done side of maximum out-of-pockets in Los Angeles, and that is going to be just for the in-network services. When we see the max for services that are obtained outside and out-of-network providers, then it goes up to $10,100. So not quite double the in-network, but still a lot, like a lot. Next up, let's take a look at the cost to see doctors, because this is usually one of the most common ways that our clients and Medicare beneficiaries in general interact with their healthcare. For doctors who are in network, we can see the copay is at $0. So I mean, that's pretty good, right? You don't get much better than $0. But for specialists, so that could be a cardiologist, that could be a pulmonologist, ear, nose, eyes, and throat doctors, and the like, that is going to be a set copay of $40, which still not too bad, but kind of on the higher side. And then we move over to the out-of-network side, we can see the prices are pretty significantly elevated to $25 copays for primary care doctors and a $100 copay for specialists, which is undoubtedly high. It really is. But that bearing in mind, a lot of the other PPO plans that are out there, they will actually just have a percentage. So not a set copay at $100 like this plan. They might say you have to pay 35% or 40% or 70% or whatever the percent is. So in that perspective, $100 copay, at least you know what you're gonna pay, and it's still less than the percentage, probably. Furthermore, when we look at emergency care, so that would be going to the emergency room or even getting admitted into the hospital as a result of an emergency, that is gonna be a set copay at $125. Now, for this benefit, because it is an emergency and rarely do we have a chance to choose where our emergencies happen, there's not going to be an in-network or out-of-network price, because all emergencies, really, no matter where they are in the city or in the county or in the state or really in the world, they're always going to be considered in-network. So that is good, and there is not a distinction, or a distinction in price, I should say, between in-network and out-network for emergencies, because there's no in-network. They're all in-network. And last up for today, let's take a look at the prescription medications for the plan, because this one is one of the few areas of the plan that doesn't have a differential in cost for in-network and out-of-network. But it can have a big impact on one's budget simply because of the additional and separate deductible that is applied. What I mean by this is that we can see here for the prescription drug coverage, this is the Part D portion of the Medicare Advantage plan, or the MAPD, there are various tiers of medications that a drug can fall into. So tier 1, 2, 3, 4, 5. But on the tier 1 and tier 2 medications, generally, these are going to be generic medications. And these have a copay of $0 for the tier 1 prescription drugs and $14 copay for the tier 2. So definitely not the least expensive, but still, as far as drug costs go, way less than paying cash. For the other tiers, tier 3 through 5, these medications are going to be having a separate deductible that is above and beyond any costs that would have been had or have paid for the healthcare services. And that deductible in 2025 is $570 that would have to be paid first at 100% by the beneficiary out of their own pocket before the health insurance plan will help to kick in. Now, after that $570 is paid by the beneficiary, those higher tier medications will have copays of $47, $35, $100, and 26% copays or co-insurances that would be applied. And that is definitely gonna be spicy. Yeah, you get those ones. Now, when we think about it, one of the only saving graces for this plan is that because of some of the legislation that has been implemented this year in 2025 under the Inflation Reduction Act, at least while it's still here, there's going to be a yearly cap on all Medicare prescription drug coverages at $2,000. So if you do end up hitting that deductible, that $570, I mean, well, you'll already be about a quarter of the way to the maximum amount of money that you can spend on medications. So, there's still that. So to close this one out with the quick and dirty of this plan is that choosing the AARP Medicare Advantage Plan PPO offered by UnitedHealthcare has the distinct advantage of the ability to choose out-of-network doctors. And to go along with that, there is going to be a whole bunch of additional costs from everything for doctors, out-of-network costs, prescription drug plans, and all the like. So making a decision to choose a PPO plan like this one should be given due consideration, because it is a lot more complicated than just, I want to keep my doctors. I get it. Good doctors are hard to find and they are great to keep, but that has to be weighed out with the cost and whether or not it's worth that additional cost or maybe even reduced benefits that you're going to get to be able to keep that doctor. For some people it is, for some people it's not. For some folks, they got to find some sort of happy medium. But if you or somebody you know is trying to wade through these types of Medicare quandaries, please feel free to reach out to us at the information down below, and either me or somebody from my team will be happy to assist them in person or over the phone at one of our many Southern California offices in English or Espanol. So for Michael's Medicare, I, of course, am Michael, hoping that you have a great rest of your day, and goodbye.